Enga Provence is called the last frontier. They say way back. Sopas Hospital. It is one of the remotest hospitals in Papua New Guinea, but it has saved so many people in this province. Because of the remoteness, no one comes here. No doctors come would like to come and work here.
I really think that everyone has the right to hope.
Welcome to Papua New Guinea. This is the remotest place in Papua New Guinea. For us to have the laparoscopic program, basically people don't believe it.
Those people have been neglected. A lot of people who are in the remote villages, they will die from the infection or from avoidable disease, totally preventable. It's very important to make these people understand that there's hope for them. DAISI is a charity organization, stands for Doctor Assisting in South Pacific Islands. And what can we do for you? The aim of this organization is to bring doctors to remote area in mainly the Pacific Island.
You don't have, electricity, very unreliable electricity. The surgery here becomes very difficult.
Every hospital is different, so adaptation is a key. So they don't have a lot of resources, but they're very resourceful. Those general surgeons will do everything to use imagination to make it better for the patient. It really does. This is quite remarkable. The genie they have to accommodate, it's phenomenal. Actually, we learn a lot from those people.
When DAISI team come here, it's different in the sense that they assess what we have and what we don't have.
So this is the extra look together.
And the donations come straight towards what we need. There's a lot of patients to operate.
What's been going on?
Week before, people are prepared, and you have people from other villages, from other islands who will come. They will travel, take the boat, walk for days to come in to have a chance. Hello. But people coming one after the other, it will not stop. Breathing, cough. People will come in and out in 5 minutes. How old are you? Follow my finger. This finger, and you have to be quick because there are too many people to see. What do you feel? Is it more pain here or here? There's no scanner. You guess and you hope for the best.
Yes.
Hello. The baby was beautiful, very nice kid.
See how the list goes.
Yeah. But the kids, you could put the 2 babies first. This is in this one, same morning. Hello, how are you? Can I have a look? Tongue out. In, again. We could do early morning, first case. Tricky one is a young boy, 7 years old, large abdomen, big tummy. How are you? What is his name? Tesla. We were quite concerned about the fact he's going to survive or not. Okay, good boy. Okay, well, yeah. First on the list in the morning. So we can do a very special surgery for you. Remember, the only chance of cure for those people, it's surgery.
When DAISI team come here, they come here to train us to be independent.
Some nurse, always the same, learn and repeat all the gestures and write down everything.
To be able to do these things ourselves.
What is missing is the introduction.
Do you have brothers and sisters? 8. So probably it's the first one in the family. Oh, little Baba.
They're training the surgeons,
How many laparoscopy have you done? 1 case.
training the nurses,
So today we use this.
they're training the anesthetist.
Ready? 1, 2, jump!
See what laparoscopic surgery is, which is so much better than the open surgery, what we do all the time here.
Okay. You're doing very well, Jamila. Can you make that balloon bigger?
Pura.
It was a combined effort with the anesthetist doing the same thing at the same time with the local one.
Many things as I do.
All this was very technical, but they have no idea what it means. The way they pick up, they understand is unbelievable. So I think I've got what I need. I'm going to scrub and we'll see what happens. So it's all the challenge between empowering those people, teaching them to do it themselves, but at the same time to be safe, because the risk is extremely high. Knife, please. Laparoscopy means that instead of making a big incision in the abdomen, you operate through a very small incision. This is challenging, this is hard, and you got people who are eager to learn, they want to know. The difference with DAISI is that DAISI show them that they have the strength and the power to do things themselves. The people get empowered, they have ownership of what they're doing. Less talking and more action now. You will do it, not me. Push. Stop, no, stop. The other way. Pull back. Perfect. Yes. There's a very steep learning curve, guys. Well done, nurses. It went much better, so well done. I'm very impressed. We managed in 1 week to do 5 laparoscopies with the local community of surgeons, nurses, anesthetists. Yeah. And now you cut. Ooh, perfect. Excellent. Well done. So you treat 5 people, but from these 5 people will benefit their community for years to come. When we go somewhere with DAISI, we tend to go back again and again to make sure that there's a continuation. We want to make lasting change. We're not there anymore, we're here. They have taken ownership of the program.
3 visits that DAISI has done to this hospital, it becomes eye-opening for the country as a whole. We are so fortunate to have you and your team. It has done so much for the staff and the doctors. Do you want them to come back again? Or? Yes. But most importantly, for the patients.
Ultimately, it's about connection with people, connection with the suffering, with the family, the children, the parents. We will invite you into the little village offering what they have, which is nothing much. They don't have much, they're poor people. They're very, very generous. You receive so much from the kindness. I remember every face I've seen there during the week. Every face. It's part of the goal. A DAISI goal is really to try to bridge the gap, to close the gap between those who don't have versus those who have. A lot of people everywhere in the world will do the same. If you add little drop by drop, you end up with a river. I think that human nature is kind. I think that people want to help. You give, and people, they give it back to you 10 times, 100 times.
Hello, sweetheart. You're just waking up. It's all finished. It's all gone well.
If people will understand that giving is receiving, it will be another place.
Bye, everybody. Thank you very much. Let Mum see him. It all went very well. The operation all went well. Thank you.
She listened to her mother, obey her parents. She's one good girl.
Hey, Chelsea, you're making noise.
Don't